Found in the agenda, because I think there's things he wants to be here for. Is there any courtesy of the floor?
I have some.
Okay.
My name is Lamont McClure. I live in Bethlehem Township. The
The whole township? No.
so, I'll give you. Do you need my address? Yesterday, a very interesting thing happened in Harrisburg. They had a budget hearing, and they were talking about the funding of nursing homes in the Commonwealth, and the acting Secretary of Health said that the state is determined to move PPD from 2.7 to 4.1, and they're going to do that. And they said, irrespective of what comes out of the national government, which I think CMS is probably also going to go to 4.1 as well. So this is the central challenge, long-term challenge for Gracedale. Of course, the short-term challenge is to get to 2.7. But interestingly, I saw on your agenda the discussion of, let me get this right, regarding an operational analysis of Gracedale. I wanted to point out to you that Senator Judy Ward is going to attempt to pass through the state Senate, and I can't imagine why this would not happen. And let me use her words. The COVID-19 pandemic has hit our long-term care facilities particularly hard. I plan to introduce a resolution that authorizes the Joint State Government Commission. I understand those are, I checked with our own senators, I understand those are high-quality studies. Authorize the Joint State Government Commission to research the impact of the pandemic on the staffing needs of the Commonwealth's long-term facilities as they pertain to the expenditure of Medicaid funds by the Commonwealth. So this is, we have half of the medical assistance residents in Northampton County at Gracedale. So this is us they're talking about. And because I know we're all good stewards of taxpayers' money, we may want to see what the Joint State Government Commission comes up with before we expend any taxpayer dollars in Northampton County on a study. They go on to say the study will examine wage rates for both staff nurses and contract nurses working in these facilities, as well as the rates charged by staffing agencies to provide these nurses. It will also look at the increase in wages from 2018 through today using the latest available figures, as well as the level of care required by the facility residents over the same time period. The changes in wages will be measured against the inflation rate. The ratio of staff nurses to contract nurses over the same time period, as well as whether facilities experienced an increase in the need for staff members with specific expertise or certification. That will also be studied. The study is to be completed within 7 months and submitted to the Senate. So I imagine that is going to catch on in Harrisburg. That all came about because of this study.
Hold on, I can do that. Yep.
Thank you.
You're welcome.
So your former auditor, RKL, whom you're very familiar with, was RKL Advisors was tasked with looking at Medicaid shortfalls. So what Sue is so kindly handing out to you is that report. If you look at the first page, it is RKL Advisors, Pennsylvania Medicaid Funding Shortfall for Nursing Facilities, prepared by RKL LLP for Leading Age PA, February 22nd, 2022. If you turn, and I don't want to take up a lot of your time with this, but if you turn to 3 of 16, you'll see that Gracedale was included in their study. It was number 88, Gracedale, Northampton County home. And then if you go toward the end, in the appendix, page 2 of 2, you will see that they found that 9 long-term care facilities were underfunded by the state a total of $13,682,472. If we have half of the Medicaid residents in the county, that's probably about $6 million that Gracedale was underfunded. So it looks like the state Senate's going to be studying the exact thing we need to know about the short and long-term future of Gracedale. Thanks.
Thank you. Any other courtesy of the floor? Okay. I'd like to hear from the Suicide Prevention Task Force first, because I'd like to save Gracedale for when Mr. Heckman gets here. So if we could have that report first.
Thank you. I'll hold it. I'll hold it. No, I'm okay. I'm going to let our Deputy Director, Robin Barbosa, do most of our presentation, but we've been wanting to show you this for a while, so it seemed like tonight we had some time on the agenda. One of the things we did last year with the Suicide Prevention Task Force was partner with Center for Humanistic Change, and they have created a few videos for us, primarily to use in the schools with our high school students, maybe some parents, and we're looking at ways to expand it. And of the three, this one is my favorite by far. So I just wanted to be able to share it with all of you, and then I can let Robin give her the rest of her report.
It upsets me when you don't listen to what I have to say and my emotions. And it hurts me that you don't really hear me.
Telling me I'm being overdramatic doesn't help.
It upsets me when you say that I am selfish or just need to try harder.
Telling me it's not a big deal or to just get over it upsets me more.
It could be worse. You think you have it bad, or you'll get over it.
It's triggering that you tell me to just be happy as if I'm not fighting so hard to be. What would help me instead is asking me, are you okay? 3 words that seem so little but hold so much power. Are you okay?
You could say, I'm here to help you and it's gonna be okay.
Just let me know that you're listening.
I care, I want to help. I'm here for you, and we can talk about it together.
What about asking about my day? What is the one thing that made me smile today? What is the one person that I looked forward to seeing today? What is the one thing that in a world of chaos went right today?
You can talk about my mental illnesses, but try to keep it positive yet serious. Many struggling people can find mental health jokes triggering.
I'm here for you, or just take a deep breath.
Can I listen to you? Can I hear you out? Can I try to understand what is happening? And I might not know, but I'm here to listen.
So these were high school students, local high school students in the county that simply volunteered to participate in this video. And the young lady in the hat is, for me especially, impactful, and, you know, seems like she's just been doing this all her life. Avidum, which you saw at the end, and now I shut it and it went right out of my head. What does that stand for, Robin? Do you remember? It was just up on the screen. I'll go back to it. But Avidum is a mental health club at Nazareth High School that they started, and we're hoping to be able to expand that in some other districts. It's student-led and student-driven, and really just to provide support for other students. And they've done some tremendous work. Jim Presto, who's on our task force, is now the board president, and so hoping to do some additional collaboration with some other districts as well. So I just wanted to share that with you. Were there any questions about that before Robin comes up? Okay. Okay, I think that's safe now.
I'll hold it up. Hello, for those of you who don't know me, my name is Robin Barbosa. I'm the Deputy Director of Human Services here at Northampton County. For those who might not remember, our task force was formed in 2018 with the support of our County Executive, Mr. McClure, and it's primarily spearheaded by our Human Services Director, Ms. Wondolowski. Our mission of the task force is really to develop and implement strategies to reduce the risk of suicide and stigma of mental illness in Northampton County through collaborative efforts of community agencies and service providers. We currently have about 51 members that comprise the task force, and it's a very diverse background. We have survivors of suicide, county staff, community agency service providers, those in the educational field, members from both health networks, and also we're starting to recruit more from the faith-based leadership because we realized we were missing out on that, that area. In the beginning, we had 4 subcommittees to our task force. We had a schools, community, healthcare, and aftercare. But during the pandemic, it was very hard for the healthcare committee to constantly meet. So the community subcommittee kind of absorbed the healthcare committee. So as of right now, we have schools, community, and aftercare. So I'll just give you a brief update of what each of those subcommittees are working on. The schools one, they'll be evaluating the PAYS survey. So PAYS stands for Pennsylvania Youth Survey. You can Google it, it is online. The most recent survey was conducted last year in 2021. And it's the survey done in grades 6th, 8th, 10th, and 12th. And it's looking at students' attitudes, beliefs, and knowledge concerning drugs and alcohol, tobacco, gambling, depression, suicidal ideation, bullying, violence, internet safety, as well as their involvement in school activities and the community and the workplace. So the full report won't be available until April 30th, but the goal of that committee is that when the report becomes available, we'd like to see what are the trends in each of the school districts. So we could say, this school district, you might have like a high percentage of those students who might be struggling with drugs and alcohol. This is what's available in your community, and these are the services that your students could seek out. So that's what they're going to be working on. And then they're also working on these student contact cards. We'll probably, hopefully, order some lanyards with the card protectors on them so that students can kind of keep them with their IDs, and it will have the suicide hotline number on there, the text number, as well as our Northampton County crisis number, our mental health number, and any other contact information that we feel that the youth might benefit from. So that way they'll always have it with them. And then they're also working on a resource guide. And it was actually like really sweet. These students from Colonial Academy did some beautiful drawings on suicide prevention and mental health stigma. And we hope to incorporate some of their drawings into this resource guide. So we're very proud of that. So the schools committee is working on those. The community subcommittee, it's probably our largest committee. I would say the 3 big things right now that we're really working on is QPR training. The task force had the ability to train several members of its task force to be trained as QPR instructors, and what QPR stands for is question, persuade, and refer. It's about a 2-hour training. I would say the training itself is like an hour and a half, but we dedicate then the last half hour if anybody wants to have one-on-one conversations with the trainer, if they don't feel comfortable bringing it up in the larger group. And it's really geared towards questioning somebody if they have thoughts of suicide, persuading them to get help, and then referring them to the necessary resources that are available out there. We are very fortunate enough to also have some staff member trained in our Northampton County prisons, so they have been training a lot of the correctional staff. We have trained county staff, so we are doing those trainings on an ongoing basis. And then our trainers are doing trainings for the community. So we would be more than willing to do a training for you all. They can be done virtual and in person. And I know with the schools committee, we're really trying to get that training to our educational leaders as well. Another big event, more information will be coming out on this in the near future, but on May 3rd, Magellan Behavioral Health is sponsoring bringing a beautiful documentary here to the Lehigh Valley. It's called My Ascension. I don't remember if we brought it up at the last time we spoke about this task force, but it is a beautiful documentary about a 16-year-old varsity cheerleader. Her name is Emma, and she did attempt suicide. She ended up being paralyzed, but through her experience, she found the strength and determination to help others find hope. And she just wants to bring about suicide awareness and prevention, not only into the community, but also into the schools. So this documentary will be a huge event. So we are working with Magellan Behavioral Health to ensure that there'll be clinicians available during the documentary, and that maybe some of our schools will be there to also represent like their clubs or whatever, but it's really just about being a support and what's, sorry, it's a little hard to breathe through here, but Emma, the student in the documentary, will actually be coming to the event, and she'll be participating in a panel presentation after the screening. So,
Robin, where and when, please?
so it is May 3rd. I believe it's at Liberty? Yes, Liberty High School. And the detail, I think it starts at 5, and then the screening will take place, I think, don't quote me, like 5:30, 6 o'clock. More information will be coming out about it. They'll have like information on how to register for the event, but it's going to be a huge community event,
So it's open to other schools to come as well. It's not a Liberty-specific or Bethlehem School District-specific event.
Correct. It'll be a larger event where people can register, yes.
What day of the week is that?
I don't know. I don't have my calendar in front of me.
I'm going to look it right up for you. How's that?
It is a weeknight, yes, that I do know.
I want to bet it's a Tuesday, but don't quote me.
What's the date?
3rd, she said, right? May 3rd?
Yes. I think they hope that the event would be over by 9, so I think the registration's at 5. I believe the viewing might start around 6. I believe the documentary is about an hour and a half long, and then the panel presentation at the end, so. And then the last event for the community subgroup, Wednesday, July 6th will be our Iron Pig Suicide Prevention Night with the task force and the American Foundation for Suicide Prevention. So we did have that event last year, and it was well attended. We'll probably do some type of viewing like we did last time. And then I know last year we did the purple glow sticks. I think it was at the 6th inning. We have wonderful pictures. Steve Barron did the first pitch. So we will definitely be doing that event again this year, and we're just trying to see like what neat things we can do during that event, so. And then lastly, the aftercare subcommittee, they developed 3 brochures that we can give out to families who've experienced a suicide loss. So we've already disseminated some of those brochures out. And currently right now, they're working on finalizing their warm handoff program. So it will connect suicide attempt survivors to the county's mental health department to give them extra support when they're discharged from the hospital. So there is one designated caseworker in the mental health division who will receive the referrals from the hospital. And then they'll also ensure that there's scheduled follow-ups for that individual just to make sure that they're well supported and that they're connected with the right resources. So that's basically what the subcommittees are working on. So if you have any questions.
Thank you. Thank you
Yep.
for the work. Just, make sure that we get the information. about
Yes.
When the events are. And are you didn't the Suicide Task Force do like awards or presentation also last year?
Yeah, so because September is National Suicide Awareness Month, so for the last 2 years, we've been doing like a press conference, and we've been honoring some individuals who have made strides in suicide prevention. So I'm sure we'll probably do that again this year.
Thank you.
Yep. And I know Sue usually takes nominations for that as it gets closer to the event. So if anyone thinks of anybody to nominate during that time, you can definitely send Sue your information.
Can groups be nominated? Does it have to be individuals?
No, we did groups. In fact, I think we did the Avidum group the first time around. So yeah, we will definitely accept groups as well.
Thank you.
Sure.
Okay, next we'll hear from Iris and Mr. Gary. because I know he loves to come and see us. But what you do is so important, so thank you for being here.
Thank you.
And if you want to introduce yourself for folks who don't know you.
Good evening. My name is Gary Rushman. I'm the Director of Information and Referral and Emergency Services. We call it the IRIS Division. Sue is handing out just a quick snapshot of what we do in IRIS, specifically to IRIS. So IRIS has two primary parts. It's our information and referral line, which is a Monday through Friday, 8 a.m. to 5 p.m. operation. We have 3 intake workers who their primary responsibility is to take referrals for a central point of contact so people can get into the county. So we'll take referrals for mental health funded services. They'll take referrals for developmental programs, early intervention, aging referrals, including the protective services referrals. And also they will handle informational calls about how to access services related to human services within the county and in communities and community-related programs. The second part of IRIS, the emergency services, is better known as crisis intervention. We have 4 caseworkers in our crisis intervention department, and we provide crisis intervention services relative to mental health, but also to all aspects of human services. So we do have our 24-hour, 7-day-a-week telephone crisis hotline. We are the delegates to handle involuntary commitments under the Mental Health Procedures Act. We do mobile crisis, which I'll talk to a little bit about how the pandemic has affected all of this. We have walk-in crisis, so while the DHS building is open Monday through Friday, 8 to 5, anybody can walk in and ask to come into our office and speak to someone. And then, like I said, we provide crisis services for all the other divisions. So we support our children and youth workers, our aging caseworkers when they go out where there's someone maybe in a crisis, or we have to provide support when they're dealing with someone who may be upset or needs some follow-up. Also within our division, within the IRIS division, we have some other departments or units that are in our division, but they're parts of other parts of human services. For instance, within the IRIS division is the children and youth screening unit. So there's a 4-person unit and a supervisor who are tasked with taking all the reports that come in through Childline or referrals to the county children and youth and assessing them at the front end and seeing where they go. They'll either go out on a case, they can immediately refer it to our intake unit or our child protective units, but they review and assess each referral as it comes in to see what level of interaction the family needs from children and youth. We also have a part-time position. It's the developmental programs a caseworker. That person is tasked with taking the intakes that come in for requests for developmental programs and doing an eligibility assessment. And the CASP coordinator. CASP is a function where if a child needs an out-of-home level mental health placement, there's a CASP meeting that's held that brings everyone that has dealings with that child, the treatment providers, the school, the family, and whoever else they want to invite in, and has a meeting to determine what's the best course of treatment. So, so we have all those people kind of within IRIS because we are the central, the initial point of contact. And if you think of it like a bicycle wheel, and we're the hub, and then the spokes go out to all the other different departments. So everything comes in through us and then is disseminated out where it needs to go. I think I caught, yep, that's everybody. But there's a lot going on downstairs. One of the things I wanted to tell you about, because I don't think I was able to speak to you in person last year. So the pandemic has affected a lot of what we do in human services. And we've seen it at our level through the referrals coming in when everything, the shutdowns occurred in March of 20. There were some interesting things that happened. Children and youth referrals actually went down dramatically. because our mandated reporters weren't seeing kids in person. That is not the case anymore, as you'll hear when you talk to children and youth at some point. But our referrals that are at all-time high, monthly referrals. One of the things that surprised me was, but it was a good thing, that our aging protective service reports never slowed down. In fact, they increased, which is a good thing because people in the community were concerned about senior citizens who weren't being seen and weren't, nobody knew really what was happening to them. So we were getting a lot of referrals about, did they have supports? Did they have food? You know, those things like that. Our mental health commitments, the involuntary commitments, pretty much stayed the same as they were from prior years, and they are still about the same number. The one thing I will say that we saw a lot of, though, was people that we don't normally come in contact with through the county. We were having a lot more interaction with. People's stress reliefs, things that people like to do, going to the gym, attending sporting events or going entertainment, going out to eat, even going to a bar, was all taken away from people. So people had no outlet for stress, no outlet to socialize. And it affected our residents in Northampton County greatly. And we got a lot of calls, and for people who had never been part of our system before, didn't even know what some of the things that we did, that the county had mobile crisis or telephone crisis. So we saw that, and we dealt with it. The numbers were up, you know, our responses, and we had to deal with that while we were dealing with our own kind of shutdown of services. Mobile crisis was by phone or by Zoom. It wasn't in face-to-face or in person, which now we're back to that. Now we're back to being in the field, seeing people, doing the assessments the right way, which is, you know, in person. Any questions?
Do you think you have enough staff?
Yes.
So those 4 people can handle those?
Well, it's
crisis
4 people.
intervention?
It's 4 people during the day, and then we have people that we contract with, part-time positions, and people that work for Northampton County Human Services. Their day job may be a children and youth worker, an aging worker. They will work weekends or nights doing mobile crisis or telephone crisis work.
What's the rate of pay for that? Contracted work?
It's based on their hourly rate that they get during the day. So they get, like a telephone crisis worker will get time and a half their hourly rate for the hours that they're doing the telephone crisis work. The other thing I will mention that we've been a part of, and it's been a great help to the residents of Northampton County, is the emergency rental assistance program. You've probably heard from Frank Brooks about that, but we are one of the conduits of how people get those applications done, and we review, we're one of the sites that reviews those applications from our tenant navigators and approves them. It's been a tremendous help to people, and the amount of help that we've had, it's nice because I've been here long enough where we didn't have that help, and we've had to tell people I can't help you. So it has been so nice the last year and a half to be able to say, yes, I can help you, and I do have the funds to be able to help you. So that's been one positive that's come out of the last 2 years.
Anyone else? Gary, I just wanted to ask you, you've been doing this a long time. And I think one of the things with Iris was, you remember the days of the centralized.
Yep.
And we changed it, and there was a lot of uproar here and there. But it sounds like the Iris is doing exactly what our hope was. Rather than have different people sitting on things, it's a central location. You come in, and you don't really hold the cases.
Correct.
Your goal is to either evaluate up front and then move on to the division that is most suited. Do the people in the divisions still have somebody who's on 24/7? In other words, we used to carry a beeper around And so if you needed to get a CYF worker,
Yes, the entire, all of Human Services has a 24-hour operation. So we have a supervisor that's on call 24/7. We have 2 different children and youth workers that are on call 24/7. We have mental health. We have mobile crisis that's not 24/7, but we can operate under a 24/7. We won't go out to people's homes at 4 a.m, but we can go into an emergency room or to a police station if we have to. We have an aging protective services person that's on call 24/7. So we do have the 24/7 operation is there, and for good reason. And the one thing, and I get back when you asked if we have enough staff, one of the things that I've been blessed with as the director of IRIS is I have more staff with 15 years plus of experience than I don't. So I have very experienced and dedicated staff that know a lot about the comings and goings and what needs to happen. So they can handle what's coming in. And it's nice because when I do get new staff, they mentor the younger staff. So we have a very good crew in IRIS in total. Like even the screening units everybody's been there, and they work very hard to make things happen. And without their work and without that knowledge base, it would be a difficult task, but they're very good at what they do.
well, I thank you for coming in because I wanted everybody on council to get a reminder and to hear about what we do. And and you're sort of like, as you said, the hub. I was thinking the bottleneck, if everybody wants to get in, because there was a time in the dark past when people would have to call they'd get transferred from one division to the next.
Right.
And so they can just go to your division and you sort all that out.
Well, and I think there's been a shift too. It used to be screening things out as opposed to getting people in the door. And I think that we're at the point now where we're doing more work as far as getting services to people and getting them in the door than telling people that this isn't the door to come through. So, and that all started when CII went to the IRIS division. So it's working. I had my doubts when you did it, but
I'm not looking for a plug for me, but as you know, there was controversy whenever you change something, to say the least. I'm glad that it's doing what it was supposed to do. It sounds like it's working the way the hope was that it would work.
It is.
It doesn't always happen.
I would say so, yes.
Okay, that's great. There you go. That's the front door.
And
Thank you, Gary.
I'll head out the back door.
Out the back door.
Save
Thank
the
you.
story about Ron for the roast. We're going to roast him one
There's
day.
no
and
story.
We'll invite you.
Okay.
There's no story.
I'll have Bill come too.
Oh, Bill.
All right, thank you very much. Have a good
Thank you, Gary. Okay. Now, Ms. Hefter said we did the suicide prevention, did IRIS. I think I'll jump to Gracedale. And what I want to say up front is I'm going to have them just give their report. I really don't want to get into a long, drawn-out debate on Gracedale, what happened 10 years ago, 8 years ago. I'm focused on getting a succinct report from them, where they're at now, if the committee has any questions, and if we have time, then other questions. But I don't want the meeting to be dominated by Gracedale. We're all aware of the situation that they're facing like others, but, I think we need to have an update, but I just wanted to put that out there. So we've got more to do in this meeting. So, Jen, you're starting off?
Good evening. Dawn's going to hand out the report. And what I did is I combined 2 months in there. We're still working on the financials, the way, how we work it. So if you have any questions, Brian is here tonight, but I'll go over December and January's basic numbers. So the census for December was 468, and in January it was 454. We had 220 beds open in December, and in January we had 234. For referrals, we had 344 referrals in December, 489 in January. Admissions for December, we had 1 emergency admit and 0 in January. We have 53 waitlisted people for December, 45 in January, but I know that's ticking up. We had 14 discharges in both months, and the average PPD was about 2.46, 2.45 for January. There were a lot of losses in December of our employees because of the vaccine mandate. They couldn't work after December 27th. We did talk about a comprehensive plan. So right now, we are not taking any admissions. We're not replacing residents who leave or unfortunately pass away. For retaining staff, we talked to everybody who was unvaccinated. We went over the pros and cons. We had doctors speak with them. We had people from all avenues if they wanted to speak and find out more about the vaccine. We educated staff on the guidelines set forth by CMS. We continued with our holiday meal for the staff. We bought pizza for everyone that was working. I reached out for the National Guard, which we did talk about at the last meeting. They came out to help us. And when they came out, what we also got was the long-term care RISE team. So they were the ones who came into Gracedale and looked over everything to make sure where we needed help. And the only thing that they found after going through all our work was that we just needed more staff. We've been trying to modernize Gracedale, and we do have the list of accomplishments attached to the packet that we gave you. We consolidated units, so this way we could better utilize staff on other units. We utilize the ancillary departments on the units. So they help assist, they answer call bells. If it's non-medical, they can do the job. We have the feeder program that they can get into, which then they can go to the floors and help feed the residents that require some assistance. Some of them are putting away the laundry. They are making beds. They are doing all those tasks that nurse aide, you don't really have to be a nurse aide to do, so they've taken over those tasks so the nurse aides can do the actual hands-on care. And then we continue to market and hire. I've included the recruitment efforts that Mary Lou and Victoria did for you all. We're utilizing the ongoing waiver for the temporary CNA classes. We're developing the daycare program. For every person that applies for a job, let's say they don't get the job, if we have about 6 candidates that come in, we're already offering them other jobs. Every non-nursing that we do hire is required to automatically take the feeding classes. So not only for our existing staff members, every new person that comes in is required to take that class. That's all I have.
Okay. I just wanted to say I watch PCN, and I know they've been doing some things with the budget, and they were talking about obviously long-term and just in general, not the funding, but the personnel, the problems that the places are having. And they did talk, when it came to long-term nursing, that they were looking at the possibility of focusing and I know when you talk about Harrisburg, the talk and the action doesn't always match up, but they were talking about focusing help to places like yours because they realize, private or public, it's a big problem. The difference is we're public, so it comes out. Privates keep it under wraps. But apparently, and I don't know if it's here yet, but supposedly there's more money coming from American Rescue that to the state, and the $30 million mark bounces around because they were talking about this. I don't know how that gets divvied up or whatever, but I mean, I would like to think, if possible, that we could somehow maybe work that into a plan. if we get extra money, I mean, particularly with Gracedale, because I know you're doing everything you can. I mean, you know, you can't manufacture employees. I mean, it's, you know, so, but I'm hoping that we can get some help with that. Does anyone have any questions for Jen? From the committee first, because I do want to limit Gracedale, because we tend to get into a long discussions on Gracedale. Tom? Lori?
I do. Again, along with what Ron said, I understand, I see your recruitment package, we know you're doing everything you could do. So my question is, what are you doing? Because obviously, if I were working there and I were understaffed, and I'd just gone through a global pandemic and I'm still in the throes of it, I would assume morale is pretty difficult. So what are you all doing to try to help with that? Or what are you doing for our staff that are there?
So we did just have, in December, we had the holiday meal, which is the kitchen cooks it up Sodexo, and then everybody comes and gets it. We did the pizza for everybody. So we try to do these things on off. For Fastnacht Day, we ran around with donuts, handed out donuts to everybody. We're working with Haven House for the mental health aspect of it. So you know that they come in and they help our residents, correct? Well, they're also going to start, hopefully we're working with them, that they can go around and visit staff on the floor, talk to them, see how they're doing.
I assume that you're working on some kind of plans that if the numbers don't increase staff-wise, to do some shifting. So is there anything that you can share with us without compromise that you're looking forward to doing that would be of some help? Because, you know, the census is down about 200 from normal. My understanding is that you're trying to keep it at that level. And when you have those folks on the wait list, like if it's 53 and 45, so is it a total of 90? Or is that the 53
No.
are either assumed or they're not coming?
So usually after the holidays, something happens. So Mike Colon in our admissions office follows up with families, and for various reasons, they're just not waiting anymore. They could have passed. There are different reasons why it had gone down from the 51.
So is the 45 what's left?
Yes,
Okay,
yes.
so that's not a new
No.
number of referrals. But what are some plans that you have to try to be more creative with staffing, with who you have? Because you're not, and again, we know that it's the same problem at St. Luke's, it's the
Right.
same problem at Lee. No one's blaming, you know, it is what it is in this country. People are not taking jobs they don't want, and they just are being very picky about it. But what are you doing with what you have?
You also have a time when, for 2 years, we were hailed as heroes, and now we're not.
I don't understand how that answers my question.
No, it doesn't.
We're not doing that. I'm asking, what are you trying to do? Like,
Well-
what are you long-range planning to?
Well, that's what we have to see. Every day it changes. Now there's new guidance coming down. So we have to wait for that guidance to see. Because CMS is looking at no longer having 4-bedded rooms. Is that going to affect us? It may. So we can't make any concrete plans because, like the past 2 years, everything gets pulled out from under us. So we take it day by day. We go to the floors, we help on the floors. We send staff to the floors. And we're just trying to get through it and see when the sun is going to come.
Okay. Yeah, and I just want to say, I think we mentioned the 4-bed because I know I read about that. And it sounds like, and I guess this ties into the money part, if we do get some of this money, it almost seems like there's a short-term, we have short-term goals and then long-term goals.
Right.
And the short-term goal is going to be, what do we do now to help you in terms of employees or to make it work? And that could mean bonuses, or if we get this extra money, big bonus. I mean, somebody might say, oh my God, but it's too much. But whatever we got to do,
Right.
it's like being in the boat, you're bailing out the water. It's not a long-term solution, but we're bailing out the water.
And you did the incentive pay.
Right, and we may have, and who knows, we may have to look at something like that stepped up. And I'm sure that's a discussion you and the administration have had and, continue to have. And then like the room thing, what are we going to do long-term? What are we going to do? I think a question that's been asked of me, and I don't have the answer, because I remember the times when we had waiting lists to get into Gracedale. I mean, it was tremendous, the amount of people. If we were to downsize, and this is always the confusing part for you, because we still have to have a certain number of staff, it's not one for one. Have we worked on where we would have, where do we get to if we wanted to downsize the beds, where we would be bringing in enough money to cover, there has to be a minimum.
Correct. And that's what we're working on now.
Okay.
Yeah.
Okay. Yeah, and I'm curious about that, because that is something, and my personal thing, and I know it's not shared by everyone, I don't worry about Gracedale covering itself. Like, you've got to pay for yourself or you're out. You're the only entity in the county, I think, that's forced to come up with, you have to pay for yourself or we're not going to do it. I mean, we get money for the courts, which might cover, 10% of their overall costs, I mean, from the state. So we don't shut things down because, but I mean, so I don't have that red line in the sand, I've often said, on what you can and can't get. But I did want to say that.
I want to answer your questions, though. The 30 million's not in yet.
Okay.
I firmly.
Is that coming to us?
Yes.
Oh.
It's county money.
Okay.
I firmly intend to have, when I make a proposal to you with that money, to have money in there for Gracedale. In the short term, and this is going to be very misleading to some people. They'll only hear what they want to hear. But in the short term, money is not the issue at Gracedale. It just isn't. That is a longer term issue, depending upon the decisions we make now and in the near term. And, just to get to the money is not the issue. The AFSCME Gracedale folks just rejected a contract offer of 2 steps and 2.5 for a total of 11.5 over 3 years with no increase in healthcare. So, yeah, 2 steps, which, as everybody knows, is a huge, is a huge offer. And then 2.5 in that 3rd year, which goes on top of the 2 steps. So it's actually more than 11.5%. I promise you, money is not the issue in the short term at Gracedale.
Well,
I'm sorry. I didn't want to extend, but you had those questions that I have the answers to.
I appreciate that.
I'm sorry, Jen.
And I hear what you're saying about the money. In fact, that's very generous. I'll speak to this. It's a labor issue, but I think what you told us now is an extremely generous proposal for the union. I'm surprised they turned it down. I hear what you're saying about money, because I'm thinking, well, let's say it's a matter of how long can we keep, because people come in, they leave. Like, if we can get 5 years out of somebody, who knows where we are in 5 years? A lot of this is going to pass. But I was thinking in terms of even almost 5,000 to 10,000 bonus, which wouldn't follow people. It's a once and done thing. What you're offering, the double step plus, that's going to influence their pension. That's going to influence their pay going forward. So that's an extremely generous offer. I'm a bit surprised. So
yeah, so was I. There may have been, we did, in all fairness, because I believe in being fair, we did ask for some work condition concessions that I hear anecdotally weren't super popular, but we thought they were pretty minor. And they were, personal time did not count toward your 40 hours, so to overtime. So if you had a personal day that week, it wouldn't count towards your 40 hours. I hear anecdotally, although it's never been officially communicated to me, that that was a problem. The other thing is, as you know, one of the things we have trouble with is attendance. About 30% of our nursing staff calling off on any given month. Philadelphia County, or the city of Philadelphia, actually has a rule where if you're out sick and you leave your house for anything other than a doctor's appointment or to go to the pharmacy to pick up your medicine, you got to call the office and say, hey, I'm going, to Long Beach Island, or, to get sun, to get more vitamin D or whatever. So they didn't like that either. But,
And you're right, I mean, I don't think any of us have the answer. And
right. I just wanted to be fair to them that they had.
Houses on Long Beach Island, we wouldn't be sitting here. But I appreciate the information.
Okay. I'm sorry, I didn't mean to.
No. That's the timer, we'll give it a few more minutes. All right, I'll go to Mr. Kusick first.
Just to follow up, one of the things that council has done is granted a bonus, and my position was that it was too low. Have you heard any feedback? Was it in fact too low, or is it adequate? Is it doing anything?
I think when you compare it to the hospitals, when they're offering the $30,000 bonuses and stuff, yes, could you say it's low? But the hospitals are still suffering. So even the $30,000 are not getting people in the door.
Okay. Then the other question I had is, I know we've done tuition assistance. We're talking about the daycare. I don't recall, have you ever considered student loan forgiveness or repayment as part of the recruitment process?
No, we've just done the, basically, we send them to school for free, but no.
That's a thing now,
Yeah.
though. So they are eligible for that. Everybody who's in, is that right? Yeah.
Right.
Yeah, I know that the state has done that, and maybe that'll apply to.
It does.
It does
We
apply.
just had somebody whose loan was forgiven because they worked for the county.
Right, and I guess my question is there anything that we can do in addition to that? Because it's a state program now, it may not exist. My understanding is that they were already running out of money for that program.
And we can certainly look into that. That's a great initiative.
It's a good idea.
Okay, so I'd like us to take a look at that.
We will.
Anyone else to my right have a question? Anyone to my left have a question? Mr. Myers?
I guess my issue is, I'm hearing a lot. It sounds to me like it's a capacity issue with staffing. So what is our max number that we're looking at? What's our minimal and what's our present? Because it's not the money, it's bodies.
Right.
So what is our top number that if we were to be at capacity with staffing?
Well, and that's what we're working on now. We're looking at the last year's numbers to look at the budgetary numbers and versus what the staffing levels are. Because right now we're at 10 floors out of 16. That's what I'm staffing. I've closed all the others. So we consolidated the most we can at this point. I don't anticipate or hope not to. And that gives us about 440 beds to play with. And I have, as of today, it's 433 residents.
Okay. Employees then, what's your numbers with that then?
I'll have to get back to you on those numbers.
Because that seems to be the bottom problem here. And the fact that we got a lot of people and we don't have enough employees and we're mandating people. People's bodies are wearing the hell out. And it's not just here in Gracedale, but it sounds to me like it's an ongoing battle that we're having throughout the county, and we got to come up with some kind of solution. That is what I'm hearing, even by Mr. McClure's statement. It's not the money's not the issue. Our issue is we're wearing what we got out, and we got to come up with a better solution, or we're going to lose a lot more people. But in this particular business, because I work at it at a different angle, this is not just a Gracedale problem. This is a national problem. And I don't know if we got the answers. Because that's what you're telling me. It's not the money, it's that you're wearing people out. And so if somebody comes in and volunteers and works for you and they end up getting mandated or have to stay long more hours, their bodies are wearing out. Am I wrong by saying that?
No, we're tired. We've been going on
2.5 years.
fumes for 2 years, over 2 years now. We're going into our third year of COVID.
So members of council, this is not the money. Physical bodies are getting the hell beat out of them, and I don't know what our answer is to that. But that's something we're going to address at every level of county, not just you, but everywhere.
Okay. Mr. Goffredo had a question.
It's a leading question, but with the proposed raise that the staff turned down, what would be the base rate for an RN at Gracedale with the raises.
That's it. The RNs are represented by the steelworkers. They agreed to an extension at the end of last year, and I don't know off the top of my head what their base
My
rate is.
question is, what is a typical RN salary?
Well, there is no typical RN salary because, remember, you have shift differentials. You have their base rate.
Yeah, just a
You
ballpark.
have their shift differentials. You know, they get extra money for working on the weekends. Of course, overtime was a time and a half?
Right.
Yeah.
Base
So,
hourly rate then?
I don't know what the base hour,
That's right, I'm just,
we'll get it for you, but,
Ballpark?
okay. I'll be right back.
Okay. My point is, I have a hard time believing, and I know this is a multi-layered problem, but money is always the number one incentive for people to work. It's the only reason why people go to work. And I don't think that money is the only solution, but I also think that some of the incentives or the bonuses or the increases are still, they pale in comparison to what other RNs are making in the private sector, which I know I'm not giving you a solution,
right.
but I have a feeling that would really help solve the problem if it was at least comparable, which it's not. It might be a third, a quarter of, especially now after the pandemic and people left the labor, the private hospitals have had to give such large pay incentives and such large, something.
You're right.
No, I'm sorry, I thought you were gonna speak, but my point is, maybe we're just not offering enough, and I don't think we're gonna be able to spend our way out of this problem. But what I see now is the few people that you have working for you are gonna be burnt out, and we're gonna have an even larger problem. So I don't know how you fix this, but I don't think disregarding money is the right approach.
So let me just, I won't say their names even though it's public information, I don't want to embarrass them. We have registered nurse here, this is just for 2021, $117,370. Registered nurse, $94,958.
Sure, but is there an hourly rate with that? Because I don't know how many hours that's equivalent to.
That's for the year. Is that
I know, but
It's for the whole year.
how many hours they worked.
Well, I think it's relevant to know what they earned in total for 2021.
The point is, I was saying to Ms. Stewart King that the hospitals are making up to $135 an hour.
Yeah, but this is a public
I know that,
facility
I know that, I
this
know
is a
that.
public facility that half of the medical assistants residents in the entire county reside at, which means the only revenue we get for those folks essentially is from Medicaid.
I understand.
Which gets reimbursed at the lowest rate.
But you still are trying to attract registered nurses. And registered nurses are being pulled from all over the place.
Yes.
So yes, it's relevant.
What's relevant?
Pay.
Oh, yeah, pay is always relevant.
I know
There's
you just said money's not the problem. I think money is a big problem.
Well, we have arm's length negotiations with labor unions that represent the RNs and who represent the licensed practical nurses and the certified nursing assistants and other organized employees. So we know what amount of money they'll take because they accept it at the bargaining table. And just at the end of last year, the registered nurses extended their contract for 2 years based on the offer we gave them. With respect to Ask Me Gracedale, I think I just said that we offered 2 steps in our contract, which your colleagues will tell you is unprecedented.
I still don't know what
And
that
then
base
2.5
hourly
in the
rate is.
third.
That's all I want. I just want to know.
Okay, we'll get that information for you.
And if I may, I think, you have access to pay scales too. I mean, so they can get that information to you, that you can see, well, here's how people would start, here's the scale, and that might help you get a better sense of where
And
that's available to you.
I just wanted to, I'm trying to work towards what the ultimate question is. We basically talked in private with Lori about, I don't see an easy solution here because, you know, if 56 is a rough number for a pay scale, it's literally a third. It's like, how do you attract people that are basically getting paid triple that in the private sector? How do we get people, this is gonna be an ongoing problem, and it looks like it's only gonna be getting worse and worse and worse.
A nursing home is a very complicated and difficult situation. You're absolutely correct. And in this climate, you're right. I mean, I think it's multifaceted, and And I'm not going to dismiss money. I think mandation, there's a lot of things that factor into it. But as a famous sports writer once answered a question for his guy, and he said, the answer to your top 3 questions are money, money, and money. So, I mean, I hear you, and I'm not arguing with you, but we can get your pay scales. And I think then you can look at like, okay, maybe we should bring people in higher. I don't know the answer. This is where we have to put a
And
lot of trust
that's
in our
basically where I'm
administration.
coming from. I think that the step in the pay scale is relevant to a pay scale that was set before all of this inflation and wage structures got completely reset.
Yeah.
And I know personally, what we've done with our wage structure in my business is drastic, something we've never done ever before.
Yeah.
So I think that's basically what I'm leading to. I think we need to relook that specific scenario, especially for Gracedale, because this problem is not going to get better.
And I think what we also have to think in, a lot of those, the $100, whatever, are because of the agencies, right? They're conflating the money. Because what you would normally get at $30 an hour, well, we don't want to come in for that. So they're going to go to nursing home A or hospital B and go, well, I want 60. Now they're going to go, oh, wait, they're going to pay me 70. And that's the problem that we have is once we start getting into the mix of that with the agencies, then we're topping out and then our people aren't.
Yeah, it's just for, my wife's a nurse, and I know her salary, or her rate, it went up, but the travel nurses, they were getting close to $300 an hour.
Yep.
So it's like, this is crazy times as far as wages go.
And
Yeah, I mean, it's like baseball. You're always going to have a Yankees and you're always going to have a Marlins. And, so the money, but all right, because I don't want to stick with Gracedale. We got other stuff to do, but I'll quickly, if you have quick questions, I'll go to Ms. Zirinsky first, because she hasn't
Ms.
asked.
Zirinsky, thank you.
Ms. Zirinsky.
So I understand that the travel nurse pay is like in a bidding war, basically. Do we perceive there's going to be any end to that? I mean, how long is that sustained, or is that a trend that we can foresee has an end in the coming year or the coming 2 years?
well, I'm hopeful that this study that the senator's doing is going to shed light on this. I know they talked about it in Harrisburg. McKnight's long-term news, if anybody wants to get on that, they talk about what's breaking, what's news, and there are rumblings in Harrisburg and across the country, how to address these issues with the agencies.
Well, there was a discussion of a cap on travel nurse pay. And where did that discussion go?
Well, we're still talking to our agencies. We're talking to them. We are.
Okay, that's all I wanted to know. Thank you very much.
You're welcome.
Real quick, point of order. That is in Harrisburg's hand, capping the agencies. So that's something that's out of our range, nothing we can do about it.
Right.
But just to point out something that else is going on that we're not taking into consideration, because my daughter's a nurse. Many people are leaving the industry in medical. That's the problem we also have. They are bailing because their bodies just can't take it anymore. And I watched the special and I was in shock at how many people who were making $185,000 a year because of what's going on. The craziness said, I can't take it no more. It ain't about the money. It's about my health, my mental. So I don't know what our answer is going to be. We're behind the 8 ball. I just wanted to make that point that, people are bailing.
On it. Ms. Hefner, and then that's it.
In the beginning of the pandemic, when you were so stressed for staff, you had people that were in other entities of human services coming in, and we were paying them to pass water, to do shifts. Are you doing that still?
We are working on a program right now.
So we stopped it, correct? And I just wondered if it was time to resurrect something like that. Because there were obviously people within human services, other departments, who were willing to come over and do that kind of work.
Yes, we're talking now about different avenues on that.
All right, thank you very much. Appreciate the report. And we're going to go on now to, we have are we going over this report I have on my desk? Or this was just?
She just, Lamont handed that out as a. He gave that to us. For us to look at.
To read?
Yeah.
All right, fine. Next I'll have, we'll have, if the director wants to say anything.
I can be super brief, or I can,
Super brief.
okay. Then to follow up, Mr. Myers, you had a couple of questions a while ago that I didn't get to last time, so let me start with those, and if that's what I get to today, that's completely fine. You had asked about the number of casework and supervisor positions in children and youth and aging. So in children and youth first, I will do, we have, in the caseworker 1 position, we have 9 of those. We have 71 caseworker 2s, and we have 11 caseworker 3s. We then have 21 casework supervisors. 21 supervisors, yes. And then there's a layer of program specialists and program directors. There's about 10 of those folks, 8 to 10 folks. And then the assistant administrator and administrator. But you had asked about caseworkers and supervisors. And in aging, I'm going to break it down by unit for you in aging, because we've heard about a bunch of different units from Lori Grieco. Our options division has a total of 8 staff. There's 6 case managers, 1 case aide, and 1 supervisor. Our assessment unit has a total of 6 staff, 4 case managers, a clerk, typist, and a supervisor. Protective Services has 11 staff. We have 7 case managers, 2 case aides, 2 supervisors, and a community health nurse, which is vacant because the pay is super low and we're working on contracting with somebody on an as-needed basis. And our senior centers have a total of 15 staff. Those are 14 of those are part-time, and then the full-time person is the director of all of the senior centers. And then we have some additional clerk typists and a couple fiscal staff. And then there's also the unit of 2 within aging that oversees the family caregiver program and PA Medi, which, if I'm not mistaken, helps get folks hooked up with Medicare. So then, just staying on that topic real quickly for aging, you heard from Lori last month, I think it was. She got an email last week this week that I just wanted to share. As you know, when we got here, when Lori took over that position 4 years ago, the same time as I arrived, we had a red rating that we had a mountain to overcome. And obviously, most of you have heard what a tremendous job that unit has done since then. They went from that 4 years ago to Lori being asked to be a presenter for the State Protective Services panel on best practices in one specific area related to protective services. So I just like to make sure I give them the acknowledgement that they have worked very hard to deserve. I don't have anything else urgent unless somebody has questions. Mr. Heckman.
Any questions? Mr. Myers.
Yes. You gave me some impressive numbers of what you're doing and everything else, but my memory serves me correct. At some point, you were saying you have different levels of supervisors, 1 and 2. Is that still part of your budget, or is that not?
It is.
So you didn't give us any supervisor 2s. You only gave us supervisor 1s.
No, I gave you.
What exactly are supervisor? What's the difference between the 1s and 2s?
It is a bizarre thing. There's only one. Let me just pull this back up to make sure I'm right. We talked about that piece last time.
During the budget we were talking about.
The casework supervisor for children and youth, it's just casework supervisor. In aging is where they break it down to a supervisor 1 and a supervisor 2. And honestly, without a paper in front of me, I don't know why, Mr. Myers, but we had 1 supervisor 1 and 1 supervisor 2, but we upgraded the 1 to a 2 so that she could fulfill the rest of the obligations required. So we don't have any supervisor 1s, if you will, anymore. They're just all either casework supervisors in children and youth or supervisor 2s.
How many people are these guys supervising in caseworkers for youth?
For children and youth?
How many people on children and youth? How many people are underneath them?
Each supervisor, the state mandate is 5 to 1, 5 staff to 1. We are, the goal is to get to 4 to 1. We are mostly 4 to 1. And we might even already be 4 to 1 in all of them, but I don't want to misspeak.
Yeah, that was the question I was going to ask, because but you answer that by you got more supervisors than they actually are requiring, which is a good thing.
But the state is moving to a 4-to-1 ratio.
Are
I
they
think.
really?
Yes, and I think within the next year. So we had started that planning in the last year or two with new positions,
Do you
so.
have any projections of what they're going to ask you to do?
This year,
22, yeah,
for children and youth,
yeah.
nothing
What? We actually are getting zero?
from children and youth. Yes, no, the last needs-based budget, which we do a year, like the year or two in advance, we did not ask for any new positions. So told them they had to take a year off. No, I didn't tell them that. I didn't.
Watch out for the lightning. You got away with one.
Okay, yeah, I mean, I think that we get really deep into the weeds. I remember that's going way back in the dark history of Department of Public Welfare. They had caseworker 1s, caseworker 2s, caseworker 3s, supervisor 1s, 2s.
Yeah.
And ultimately, I think we were dumping supervisor 1s because it was almost like a trainee position, and it's.
Aging's the only place we
That
still
makes
have that option, and I think protective services, they're definitely 2s, and.
Yeah, that's bureaucracy at its best when Harrisburg put that together. Okay, any questions for Sue? Thank you, Sue.
Thank you.
Now, we had, the president had asked me about putting this on the agenda. We don't have a lot of time, maybe this will carry over to the meeting, but a discussion regarding the operational analysis of Gracedale. I'm going to turn it over to you.
Why I
Madam
asked you
President.
to put this on the agenda is prior to putting out any RFP, I think we need to have a discussion about what we're looking to address, what we're asking for. So I just wanted to create the beginning of an opportunity to have that conversation, or to at least state the intention that we are going to be addressing this at a governance meeting in 2 weeks, and that I want everyone on council to think about, okay, if we're going to invest money and time in this, then what are we looking to study? Because I'm not going to write an RFP without your input and then forget to ask something, and then later you go, oh, what about that? And so if we are going to have an operational analysis, then what specifically are we going to be asking someone to do? What do we want to focus on? You know, in light of Mr. McClure's information today, are we going to focus on pay? Are we going to focus on other things? So I just wanted to open that up to the beginning of a conversation and have you put some stuff in writing, and then we can talk about it in 2 weeks. And I'm going to let, Ron, do you want me to?
No,
Or you
no,
wanna-
I mean, I'll give an example when Mrs. Hefner brought this up to me. Going back, when I was director, we did the Zimmett report, and that was at a time when things were adjusting. We used to get a lot of money from the state, the rates were high, the privates didn't want to take our people, and then things changed. And we were running at what's known as a deficit because we had made money actually at Gracedale, and then all of a sudden we weren't. And I brought in somebody, and we really wanted to be specific. And basically what we said was, where can we get more revenue that we may not be capturing? And where are there costs that we are incurring that we may be not taking care of? We got a lot of input on revenue. We weren't doing some things. I mean, we were letting things slide. And keep in mind, you had an entrenched bureaucracy out at Gracedale at that point where they were running the way they ran for the last 30 years. And so but it was very focused. And I just said to her, if you're going to do a study, I think you're going to want to make sure that it's like, has a focus to it. I don't know how much you can throw into a study, but that was my only comment to her and my advice from my perspective.
Pete, do you want to call on people, or do you want me to?
No, go ahead.
Okay, John.
No, I was gonna say-
John 1, then John 2.
I had my steroid shot.
Is it
so I
Dr.
had slight
Seuss,
rage.
thing 1 and thing 2?
I think the most obvious place would be, we're operating at a fraction of the capacity and we have less staff. So is there room to we need to be able to create more revenue and be able to pay nurses more, pay the staff more, but we're also not taking up the amount of floors, the amount of space. How do you cut down your overhead when you're not running at full capacity and full staff? And where can we do that? I would assume that would be what they could focus on. Operation overhead lowering.
Okay. Mr. Cusick?
Yeah, so real quick, as much as I appreciate the interest from Harrisburg, I think the bottom line is that they have failed to increase the Medicaid reimbursement rate for year after year after year. So, I mean, yeah, they've finally woken up, but to me, that is the fundamental issue. They have to increase the Medicaid reimbursement rate. That's first and foremost. Secondly, what I would like to see studied is, and it's been brought up previously, what would we have to do should the CMS model go from 4 to a room to 2? Personally, I think we should move to 2 in a room anyway, because 4 is no longer an industry standard. So I would like to know what would be involved from a financial and a personnel and even an architectural standpoint. What would we need to do if that were to be put in place?
Anything else? Any input? Okay, yeah, and obviously, it's not necessarily designed to be, but we're gonna put it in the RFP, because we don't have a ton of money. We don't have $1 million study. We have a finite amount of money to ask somebody to do this and give us a report, so. All right, thanks, that's all I wanted.
Is that it? Are there any other human service related questions? If not, I will thank everyone who came and contributed. I thank the Gracedale staff for coming out as usual, and we're adjourned. Ms. Hafner told me she moved to adjourn, so we're adjourned.
Oh, I sure did.
Who is that? Yeah, I saw the box. Oh, okay, yeah. I was. Oh, okay.